they made a major change that is slowly going down the tracks, and they're going to change the prescription drug plan, which was supposed to be changed at the end of next year. They're going to upgrade it and change it this year, December 31st, 2026. So whatever has happened in regard to Reduction Act that Biden did is going away. And that saved everybody on Medicare a lot of money and a lot of costs on their prescriptions and their prescription drug plans. And now they're going to change it. We don't know what the costs are. Every year this book comes out, and it has to get to us by October 1st, because all the information on changes in Medicare Advantage Plan and Medicare Part D are all in the back of the book. So they're going to have to redo whatever book they've already printed up, because the changes are going to be effective for next year are going to be effective December 31st.
So what do people need to know about these changes?
What people need to know is that they need to really go online and October 1st is when they're going to show what the new changes are going to be. So every year in October, on October 1st is when Medicare releases what all the new prescription drug plans are, and what they're going to cost and what they're going to be. They changed drastically last year. The cost has gone up on some. So we don't know what the costs are going to be for the plans for next year, because they just made the change in what Biden had done, and now that's going away. And the changes are going to take effect January 1st. It's going to cost everybody a little more on their premiums, but we don't know what the prescription drug costs are going to be.
So since these books don't come out until October, right? You were saying they have to. So people, what's the way that they're finding out about this, if they are at all?
How they're finding out about it is by what was posted online as far as news. I mean, that was gigantic and huge that it was posted yesterday that he is going to make the change not in 2027, at the end of 2027. They're going to make the change as of the end of December 31st, 2026. So when Biden did his act that happened in 2024, those changes, the cost in prescription drugs, the government, the prescription drug company, and the pharmaceutical companies all had to bind together to pay the extra money that is due. And those days are gone. You have to understand how Medicare Part D works. Once a person reaches $2,100 in actual out-of-pocket cost for their prescriptions, like if it's Remicade or whatever their expensive prescription is, once they max out and they pay $2,100, then they don't have to pay another penny for the rest of the year. I can't tell you what the costs are going to be because they haven't released it. They just released yesterday that plan that was part of the Inflation Reduction Act.
Mm-hmm.
What is part of the Inflation Reduction Act is going away. And this is really, really, really important. So what America needs to do, what the Houston area needs to do, is when October 1st comes around, you need to go on Medicare.gov and find out which one's going to be your best prescription drug plan. Don't just go by a name. You got to get in the game and make sure all your prescriptions are in there and that you're picking the right prescription drug plan to meet your needs, not to meet the needs of the agent that comes in your house to sell you something. And if anybody needs to, they can visit me on my website, which is tonisays.com, and so that you know what's the right way to go. It's not about the insurance companies. It's about making sure that your prescription drugs are taken care of. Some people's prescriptions are $1,000 a month. Some people never take a prescription. So it's, we've got 69 million people on Medicare.
Mm-hmm.
There are 10,000 right now turning 65 every day. One person is turning 65 every 8 seconds a day. So they need to know what is the best thing for them to do. You're going to get your Medicare and You handbook probably by the end of October. I don't know whether they've already printed them out,
Mm-hmm.
but we don't know what the new prescription drug plans are going to do because of the change that just happened yesterday.
But your big advice to people is October 1st, go on the website and see what's best for you as far as prescriptions are concerned.
Right. Get your kids involved. I mean, some people are 90 years old trying to figure out what their prescription drug plans are.
Mm-hmm.
Some people are 60. Some people work in a nursing home or assisted living center or for a doctor's office or whatever.
Mm-hmm.
Normally, everything is already done, and they are starting to print this book out
Mm-hmm.
to send it out to us. And it's got all of your Part D, and it's got all of your Medicare Advantage plans. It's all about marketing. That's why they have to get it to you by October 1st.
Mm-hmm. And that's good advice there about, my grandparents are 94 and 98 and are, their kids, my aunts and uncle and stuff like that help out with all of that. And they have that help. So being able to, you don't have to be whatever age you are, just asking for another opinion or asking for some sort of help is really something that could benefit you.
People need to learn how to put yourself first.
Mm-hmm.
You need to learn what you need to do. If someone is calling you, and I do workshops on Medicare fraud is exploding. If someone is calling you and you don't know who that person is on the phone, don't answer it.
Mm-hmm.
You're a walking dollar sign. All they're looking for is just maybe changing you from your Medicare supplement to a Medicare Advantage plan.
Mm-hmm.
I mean, it can be very, 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 very confusing. But the change from the Inflation Reduction Act, last year your maximum out of pocket was $2,100. If you're taking, you may be on Xarelto, Eliquis, Jardiance. I mean, there's a lot of real expensive insulins that cost a lot of money, cancer meds. You have got to take your time and make sure that you meet your needs. I have some people that, because I'm still an insurance agent. That's how I got started. I'm an insurance agent. But I have some people who never changed their prescription drug plan. About 4 years ago, and I don't mention names of insurance companies because I'm not here to represent an insurance company. There was one company, their premium was $6. I was on them. Mm-hmm. They were very affordable. Then they went up to $9.80. Then they went to $44. Last year, the premium was $94 and I think 60 cents. Who knows what it's going to be next year?
Wow.
Yeah, so that's been they're a very big player in the game. So if you never changed and they're not the one that's best meets your needs, I'm on a prescription drug plan that has a 0 premium.
Mm-hmm.
So you got to get in the game.
But you have to also have, I guess, someone that is maybe a little bit more tech savvy or knows what they're doing. I mean, I'm just saying for people who are a lot older that might need that help. It's just so good to get somebody that might be correct able to do that.
You may be someone who's living in an assisted living center or a nursing home, or maybe you're on hospice, mm-hmm. or maybe you've got some health issues, or maybe your husband now has Alzheimer's and you really don't know what mm-hmm. to do. I can tell you if someone calls you and you don't know who the person is on your cell phone, don't answer the phone. If someone comes to your door to try to sell you something, because they'll go from door to door to try to sell you their Medicare Advantage plan, and maybe you've on original Medicare with a Medicare supplement, and you think, I need a gym membership. Mm-hmm. This is very important. Well, a gym membership is not going to pay your medical bills.
Right.
So there is no do-overs.
Mm-hmm.
As far as Medicare is concerned. As far as Social Security is concerned, there's 3 family members to enrolling in Medicare. There's the IRS, Social Security, and Medicare. The IRS tells Social Security all your money, and Social Security enrolls you in Medicare. Medicare doesn't even know how to enroll you in Medicare. They let Social Security do it all. So are you ready to help your parents get on Medicare?
Well, yes, my mom. Yes, I hope that everybody got some great information here because, it is important to know that you can change prescription plans. I don't know if everybody knows how to do that or knows that that's even a possibility.
And you can call Medicare at 1-800-Medicare. They will help you find what's the best plan. You can visit my website and talk with us. And we're not going to push one plan because we're not going to make money off of it. We're going to help you find what's the right plan to best meet your needs.
It's good to have this information, and thank you so much for coming in and talking to us about it.
Okay, well, if they need any other information, remember, this is your Medicare and You handbook, and the one you're getting may not be exactly accurate. You need to learn how to go to Medicare.gov to find out what's going on.
All right, thank you so much. Thank you.
See you later. Bye.